The goals and objectives are educating on who Dorothy Orem is, what her self-care theory is about, and how it is applied and practiced through a skit. Hi, my name is Dorothy Orem. I was born in 1914 in Baltimore, Maryland. I had been on many units throughout my nursing career, including the OR, pediatric and adult med-surgical units, and private duty. I am very fascinated by education as I sought out my master's degree in nursing education. My colleagues and I created a self-care nursing theory. It has 4 major concepts, which are self-care, dependent care, self-care deficit, and nursing systems. Self-care focuses on the drive that persons have to care for themselves. Dependent care focuses on how the person relies on others to assist them with their care. Self-care deficit focuses on when a person can't perform their ADLs or lack of knowledge to properly perform certain tasks to better their well-being. Nursing system focuses on having a relationship between the entire healthcare team, which can benefit and improve patient outcomes. The first meta-concept is the person. The person is viewed as a whole who is capable of performing their own self-care. They are viewed biologically, symbolically, and socially as well. Assessing the patient's knowledge and readiness for learning will determine the teaching provided. The environment contains characteristics of physical, chemical, biologic, and social context in which a human being exists. It can affect a person's self-care either in a positive or negative way. Assessing the environment allows the nurse to accurately provide resources and tools easily accessible for patients. The health is depicted by safety, security, and comprehensiveness of one's health and their way of functioning. Health can impact communication and the ability to care for oneself. It also includes the prevention and treatment of illnesses. The nursing systems establish aptitudes that allow nurses to act on the situation, evaluate the condition, and provide assistance to improve patient outcomes and meet their goals. The role of the nursing team is based on a patient's need.
Hi, I'm Amanda and I'll be the nurse today.
Hi, I'm Andy and I'm Dorothy Orem.
Hi, I'm Carolina and I'll be the patient.
Hi, I'm Amanda. I'm going to be your nurse today. Can you tell me your name and date of birth?
Hi, my name's Carolina Vitita and my birthday is 9/9/93.
Okay, so I'm going to assess you today, take your vitals, and then we'll go from there.
Okay.
Can you tell me your height?
5'8",
Okay, and your weight?
200.
Okay, so first I'll take your blood pressure.
Nurse, can you bring me some salt? I want to add some salt to my burger.
Okay, hold on 1 minute. After we do the vitals, then I'll bring you some salt.
Thank you.
So it was 220 over 110, so it's a little high, but that's okay. I'll just document that.
That's my normal.
Oh, okay. That must be fine then. So your stomach seems a little bloated. When was the last time you had a bowel movement?
2 days ago.
Is that normal?
Yeah.
Okay. So I'm going to go document that and finish and let the doctor know. Do you need anything else?
No, I'm okay. So these are the medications I take.
Okay, how often do you take them?
I don't know, I just take them when I don't feel good.
Okay, just keep doing it like that.
Thank you.
And would you like anything else?
Yeah, I think I want another soda.
Okay,
And some fries, and I need some salt for my fries too.
Okay, I'll call the kitchen and order that, and I'll bring you some salt. I'll be back in a little bit.
Stop. In this situation, my self-care theory was not implemented in the patient's care. The nurse did not provide teaching the blood pressure ranges, medication, and nutrition and diet. Also in the situation, the self-care deficit was not improved and the patient care outcomes were not met.
Hi, I'm Amanda. I'm going to be your nurse today.
Hi, Amanda.
Can you tell me your name and date of birth?
Carolina Vitita, 9/9/93.
Okay, so today I'm going to assess you, get your vitals, and then we'll go from there.
Okay.
So first I'm going to do your blood pressure. You're snacking away there.
I know, my burger got cold. I think I'm gonna need you to warm it up for me.
Oh, we're gonna talk about how we can eat some healthier options.
That doesn't sound fun.
Oh, I'm gonna make it fun. Don't worry. So it was 220 over 110, and that's a little high, but
That's more normal though.
the normal range is 120 over 80. So I'm gonna document that, but I'm gonna talk to your doctor and see, and I'm gonna teach you some interventions to help lower it and make your lifestyle healthier to help you out with your hypertension. Also, I have to ask a few questions. Are you on any medications? Because they didn't document it during assessment.
Yeah, I brought
Admission, I
two
mean.
that I take.
Okay, so metoprolol and lisinopril. Do you know why you are taking these medications?
I am not really sure, no.
Okay, so they both lower your BP since you have hypertension and since your blood pressure is high. It was 220 over 110. So normal blood pressure is 120 over 80. So these are to help lower your blood pressure, but you also have to have diet, exercise, which we'll go over later,
Okay.
on how to improve it. So it's just not taking the medication and then your blood pressure is just not to magically go down and lower. So it's about implementing a few things into your life at home to help with that. So I'm going to teach you a few things about your medication. So your metoprolol you can take every 12 hours, but before you take it, you want to take your blood pressure and your pulse. So your BP, if your systolic, which is your top number, is lower than 100, so like a normal blood pressure is 120 over 80. So systolic, it would be the 120, that's your top number. If it's less than 100, you do not take your blood pressure medication. And then pulse, when you take your pulse, if it's less than 60, then you shouldn't. You should hold back and not take the medication. So before taking the medication, you should take your blood pressure at home and your pulse. Do you have any questions so far on that?
I just know that I need to get one of those things that do it for me because I don't know how to.
Well, yeah, and that's helpful. And you should also have a journal. So when you take it, write it what it was at that time before your medication. So when you go to your doctor, they could sort of see how it's been falling when you've taken it.
And if it's low and I don't take it, can I take it like 2 hours later if it goes
No,
high?
you should wait and then
Wait till the next dose.
the next dose. So then, but then for the next dose, you have to retake it to make sure that it's in the normal ranges. Don't just take it because you didn't take it the time before.
Okay.
And so some side effects with the lisinopril, it can cause coughing. So if you start coughing a lot, you didn't want to call the doctor, and then you can come in and the doctor will assess you, and then they could always change your medication.
Okay.
So do you have any questions about that? So yeah, it's just checking your vitals before you take them because we don't want it to go too low and then you can have adverse side effects.
Okay.
And so since we're doing a little bit of teaching about that, if you want to put those over there. How is your exercise? Because with hypertension, we need to be at least 30 minutes a day, even if you start with walking. Okay, what's your height?
5'8".
Okay, and your weight?
200.
Okay, so with your height and weight, for exercising purposes and for your weight's a little above, so it will help you with your hypertension too. At least walking every day, even if you just do 30 minutes of walking to start and then increase, is going to help with a healthier lifestyle and it'll have the benefits and improve your quality of life and it'll be good for you.
I just feel like I don't have the time.
Yeah, even 30 minutes if you can, even if you don't have 30 minutes, even 15, just to get some exercise every day is going to help. And writing down your food log. So with food, like I know in the beginning you can't just go change to all healthy, but trying to implement more healthier food choices. Even you can have snacks, but like trying to do a little at a time to get to being healthier. But a food log is good because it'll keep track of like, oh, I could have maybe ate a little healthier there, and it shows when you go to your appointment. You can show your doctor your vitals, your food chart, so that will help you. Do you have any other concerns that you want to talk about?
I don't think so, no.
And that's how you're going to implement it in your life to help increase, because we want you to be overall healthy. The goal, the patient outcome, and the goal for you one day is to lower your blood pressure by your food, by your eating and your exercise, so then maybe we don't have to use the medications. Because
that would be nice.
Yes, and overall, taking medications, if you just take them, it's not going to make the blood pressure go down. It's implementing a few different aspects to help lower it. Okay, so I'm gonna go get you some water with lemon, like we talked about, and a healthy snack, and then I'm gonna come back and we're gonna talk about what I taught you, and to make sure you fully understood it, so when you go home that you have the best outcomes, and to help you lower your blood pressure and to help control your hypertension.
Okay.
Okay, I'm back. I brought you a banana, like we talked about, to increase your fiber in your diet, and some water with lemons to see if that helped taste, give it some flavor instead of having pop and all of that.
It tastes good.
So now we're gonna talk about what I taught you. I'm gonna ask you some questions, and to make sure that you will fully understand how you should be taking your medication, the food choices, and some of the exercise component of your care plan. So with the medications, when should you hold back your medication?
If my pulse is under 60 or if my systolic is under 100, which is the top number.
Okay. And when you hold it, when do you check to see when you can take it next, or when should you take your medication next?
Before the next scheduled dose.
Right. So right before the next time, and then take it. Do not wait 2 hours and then go, oh, it's been 2 hours, let me take it. No, that's not safe. That's not what we're supposed to do. And so how did I tell you about increasing your fiber in your diet and healthier food choices?
Fruits, vegetables, and water.
Okay. And also protein in the diet, like keeping away from fried foods. You want to grill it as much as you can or bake it, because that all has cholesterol, which will increase your blood pressure, and it's just keeping away the healthy, trying some fish, so grilled chicken, things like that, the protein, eggs, so just trying to, the snacky foods and the foods that are processed that have a lot of sodium, salt, and all of that is going to increase your blood pressure, and that's going to have a negative effect with your hypertension. And exercise. What are you going to do now when you go home? How are you going to slowly implement what I taught you?
I'll try to walk more, even if I just park my car, like at the end of the lot, to walk to the store and stuff like that.
Slowly, yeah, and just keep increasing. Do you have any pets that you can walk at home?
Unfortunately, I do not.
So maybe one day you'll get a dog and go take the dog for a little walk.
I should.
But yeah, there's just slowly implementing to have the highest patient outcome that we can for you. And it's baby steps, but eventually you'll get there, and hopefully the goal will be not to take those medications anymore. So do you have any questions?
No, at this moment, no.
Okay, so I'm gonna let the doctor know what we talked about, and he's gonna be in to assess you too later.
Okay.
Okay, I'll be back.
Ta-da! And that is how my self-care theory should have been implemented in the nursing practice today. The nurse was able to provide teachings about the medication regimen, the lifestyle changes, and the nutrition and diet. The nurse was able to ask questions to the patient regarding the care that was being talked about, which the patient then expressed what she learned and how she's going to implement it into her lifestyle. In conclusion, the self-care theory by Dorothy Orem is essential in the nursing practice. It increases patient outcomes by educating and teaching the patient about their health problems. It is valuable in achieving specific desired outcomes to meet the personal needs. Teaching is the greatest method when applying Orem's model with patients.
Ta-da!
And that's how Dorothy Orem's self-care theory is implemented in the nursing practice and how important it is for teaching to be done in a setting to improve patient outcomes.